Hello, my name is Pauline RN. Welcome to my channel. The title of my video is Mobility. This is part 3. We're talking about heat and cold application, questions and answers, RN Nclex examinations. Please hit the thumbs up. Please subscribe with that black button. Please share this video with your friends and families and classmates. My first question is, why do we use heat and cold applications? The correct answer is to decrease inflammation, decrease bleeding, decrease fever, decrease muscle spasms, decrease swellings is the correct answer. What are examples of warm water compresses? Correct answer is warming blankets, whirlpool, thermal heating pads is the correct answer. My next question, what are your safeties with applying heat application? Correct answer, monitor temperatures, prevent burns, use a barrier, example, wrap with a towel. Do not apply directly to skin. Prevent burns on skins. Prevent redness and irritations on skin. Apply with a use of a barrier. Next question. What do we do for sprains? How do we take care of sprains? Correct answer is RICE. RICE. Rest, ice, compression, and elevation is the correct answer. There is pain, there is swelling present. Elevate the extremities. Next question. What are your contraindications of heat? Correct answers. 24 hours after surgery, edema, active bleeding. Next question. What are examples of moist heat? Correct answer, hot packs, hot compresses, warm soaks, warm water in a basin. These are examples of moist heat. Next question. When do we use a sitz bath? Correct answer. Post-op hemorrhoidectomy, incision and drainage of rectal abscesses. Postpartum for women who have given women with vaginal delivery. Sitz bath should be given for 20 to 30 minutes with warm water. Give examples of dry heat. Correct answer is hot packs, warming blankets. Place all on warm temperature to prevent burns. Why do we use cold applications? Correct answer, to decrease inflammation, decrease swelling, to decrease fever, lower a temperature, decrease bleeding, decrease muscle spasms is the correct answer. Give examples of cold moist application. The correct answer is cold water compresses is the correct answer of cold moist application. Example of cold water compresses are correct answer. Cold water soaks in basins is the correct answer. What are your example of dry applications? The correct answer is your ice packs, ice collars, ice placed in gloves can be used. Why do we use cooling blankets is this question. Answer is to decrease your fever. If your patient, maybe the temp goes up to 103, the doctor will ask us to order a cooling blanket for our patients. Electric cooling blankets regulates patients' temperatures. Next question, when you're caring for patient with diabetic neuropathy, what should our considerations be? Correct answer is turn patients every 2 hours, especially non-verbal patients who cannot verbalize pain or sensations. Patients with diabetic neuropathy, they are at risk for injury and tissue damage. They have decreased sensation to hot and cold. So check your water temperatures when you're bathing them or soaking their feet. For patients with diabetic neuropathy is the correct answer. These are your caring considerations. Next question, what will be your considerations for vascular insufficiency? Correct answer. Cold applications are not for patients with vascular insufficiency is the correct answer. What would be your assessments for skin integrity for patients with cold compresses? The correct answer, assess the patient. Skin is too white, too cold. Assess pulses. Check capillary refills. Capillary refills should be less than 30 seconds. Next question. How do we prevent burns from hot compresses? How do we prevent burns from hot compresses? The correct answer is assess movements, sensations for patients. Assess skin too red. Next question is, how do we do our cold assessment? Correct answer is assess skin too white, assess the pulses, assess capillary refills less than 30 seconds. Pulses too weak or absent with cold compresses, notify your doctors. To prevent burns, we assess movements and sensations for your patient. Assess skin's too red is the correct answer for burns. Next questions. SCD, sequential compression device, is used post-operatively. How do we use these machines? SCD machines. Correct answer. The device is wrapped around the calves, connected to a machine to keep legs warm to prevent DVT. Assess pulses weak or absent, please hit the thumbs up. Please subscribe with that black button. Please share this video with your classmates. This was mobility part 3. Stay tuned for mobility part 4. Thank you. Have a good day.